24-year-old male, no clinical information available. Our patient presents this AVM. So we have here the on the left, the frontal view of the left internal carotid artery angiography, and on the right, the lateral projection of the same angiography. We can see here, this is the MCA, this is the genu of the MCA, this is the M2 segment, and then this is the M3 segment of the MCA, M3 segment of the MCA. So we can see here there is an image compatible to the AVM and supplied by the M2 and M3 branches of the MCA at the plenum temporale. And also we can see that there is a lateral lenticular artery supplying the medial part of the AVM. This is the nidus, and this is the draining vein. It goes apparently first forward and then anteriorly and laterally to come to the surface of the sylvian fissure. So actually this AVM is hidden inside at the medial part of the sylvian fissure at the posterior part of the insula. Most of the time, the draining vein can serve as a very good landmark for you to access the tumor, the AVM. So we can tell that at least on the frontal view, there will be AVM medial and AVM lateral to the draining vein. So let's go to the lateral projection. We can see here this is a draining vein. We know that this is already on the surface. This is in the depth of the sylvian fissure. This is going to be AVM, a little bit of AVM above the draining vein, but the most of the nidus are located behind and below the draining vein. So we have to pay attention to this. So we already know by looking at the AP view, anterior posterior view, it's going to be AVM here, lateral, and also medial to the draining vein. Most of the nidus are located posterior to the beginning of the draining vein. So at least this is what I'm expecting. So this is not on the surface. This AVM is in the depth of the sulcus, of the sylvian fissure, I mean. So where is this AVM located? It is located in this area, at the posterior part of the insula, at the medial part of the plenum temporale in this area. So the AVM is going to be supplied by branches of the MCA, and also that very long lateral lenticular artery that will supply the medial part of the AVM. So AVM will be here. In surgery, we have to split the sylvian fissure to find AVM, and then the draining vein will be draining forward and then laterally and still forward to come to the surface, and then probably draining towards the superficial sylvian vein. So this is the exposure after the dural opening. So this is on the left side. This is the parietal operculum. This is the temporal operculum, the posterior part of the sylvian fissure actually. And this is the superficial part of the draining vein. We know that the AVM, the nidus, is hidden in the depth of the posterior part of the sylvian fissure at the posterior part of the insula. So as the principle of any AVM surgery, you have to dissect, you have to open the fissure, you have to open the sulcus and try to find the feeders. The feeders will be those MCA branches running the depth of this region, the plenum temporale, and then they are all in passage arteries. So they will supply AVM and then will exit the sylvian fissure to supply normal brain tissue. So let's go to the video. So this is what he's doing. He's dissecting to expose better, open the fissure, and then he found this part of the draining vein, which is already hidden inside the sylvan fissure. We all remember there will be AVM above, below, behind the draining vein. Now he's dissecting the sylvan fissure. He's following the vein. You can see he already found important artery over here. He would follow the artery. This is one of those branches running towards the plenum temporale. He will try to identify the branches of those arteries that will supply the AVM. And then he went first on this side, and then this is up. So he will try to find another MCA branch that will supply the AVM. You see there's another artery over here. Just follow the artery, follow the veins, and see this is artery underneath here. And he will see the pathological branches of coming off this artery to supply the AVM. He's following the artery. This is the artery. This is up. So pathological branches going to the AVM has to be coagulated and cut. He's doing now a circumferential dissection, and all the branches going to the nidus, or to the vein has to be coagulated and cut. And you see the arterial branch over here? So we already saw it on the angiogram, most of the AVMs is located posterior and inferior. Temporal is inferior, parietal lobe is superior. So it's a little bit superior, but most part of AVM are posterior and also inferior to the draining vein. So this is what he's doing now. He's working first on the superior part, and probably medial part, because there's going to be an anterostriate artery supplying the AVM. So this is working now on the inferior part and also the posterior part of the AVM. Leaving obviously the vein, draining vein, intact. You sacrifice only the draining vein. You see the artery over here, the branch going to the AVM. So this is in passage. So you only coagulate the AVM, the vein, when you're sure that it's gone. You see this is in passage artery, another in passage artery. This is artery, this is artery. Now he's sure that the AVM is gone, so he's coagulating the draining vein. And nothing bleeds and nothing swells. This is a removal and the final aspect of the surgery. So this is the postoperative angiography, frontal view and the lateral view, showing the total removal of the AVM.